battery ingestion. When to suspect that a person has swallowed a battery? The person who has swallowed a battery may have one or more of these symptoms: vomiting, retching, abdominal pain, low grade fever, irritability, persistent drooling, difficulty breathing if the battery is blocking the airway, rash from nickel metal allergy, dark or bloody stools. If it is suspected, then do not induce vomiting. Administer honey immediately and while en route to the emergency room if a lithium coin cell may have been ingested. If you don't know what kind of battery was swallowed, then assume that it was a lithium coin cell unless it is a hearing aid battery. The child is 12 months of age or older because honey is not safe in children younger than 1 year. The battery was swallowed within the prior 12 hours because the risk that esophageal perforation is already present increases after 12 hours. The child is able to swallow and honey is immediately available. How to dose honey? Give 10 ml, that is 2 teaspoons of honey by mouth every 10 minutes for up to 6 doses. Do not worry about the exact dose or timing. Use commercial honey if available rather than specialized or artisanal honey to avoid inadvertent use of large amounts of honey produced from potentially toxic flowers. Honey is not a substitute for immediate removal of a battery lodged in the esophagus. Honey slows the development of battery injury but won't stop it from occurring. Do not delay going to the ER. Why give honey? Honey is administered to coat the battery and prevent local generation of hydroxide, thereby delaying alkaline burns to the adjacent tissue. If the patient is asymptomatic, take up to 5 minutes to determine the imprint code from a companion or replacement battery packaging, or product instructions. If no imprint code is available, measure or estimate the diameter based on the size of the slot the battery fits in or the size of a comparable battery. If the patient is less than 12 years, immediately obtain an X-ray to locate the battery. Batteries lodged in the esophagus may cause serious burns in as little as 2 hours. Do not wait for symptoms to develop. Patients with a battery in the esophagus may be asymptomatic initially. The 2 mm diameter lithium coin cell with a diameter intermediate between a US penny and a nickel is most frequently involved in esophageal injuries. Smaller cells lodge less frequently but may also cause serious injury or death, especially in children younger than 1 year. If the patient is more than 12 years and the battery diameter is more than 12 mm or unknown, immediately obtain an X-ray to locate the battery. If the patient is more than 12 years and the ingested battery is less than 12 mm, no X-ray to locate the battery is required if all of the following conditions are met. The patient is entirely asymptomatic and has been asymptomatic since the battery was ingested. Only one battery was ingested. A magnet was also not ingested. The battery has been reliably identified based on imprint code or measurement of an identical cell and the diameter is less than 12 mm. Definitive determination of the battery diameter prior to passage is unlikely in at least 40% of ingestions. Assume hearing aid batteries are less than 12 mm. There is no history of prior esophageal surgery, esophageal stricture/narrowing, motility disorders, or other esophageal diseases. The patient or caregiver is reliable, mentally competent, and agrees to report symptoms that develop prior to battery passage or over the subsequent month if passage is not documented, and understands the importance of promptly seeking evaluation for symptoms possibly related to the ingested battery. Immediately remove batteries lodged in the esophagus. Serious burns can occur in just 2 hours. Do not delay battery removal because a patient has eaten recently or because a patient was given honey. Medical treatment for battery ingestion. Immediate removal of the battery may be indicated in the following cases. If the X-ray shows the battery is located in the esophagus, that is a food pipe. If the person develops symptoms such as abdominal pain or vomiting blood, minor changes in stool color or minor vomiting are not indications for removal. If the battery is large, that is 15.6 mm or bigger, and the child is younger than 6 years of age and the battery does not pass through the stomach within 48 hours. Battery removal will likely be accomplished with an endoscope. An endoscope is a flexible fiber optic scope with ports for grasping devices to be passed through it. This scope is passed through the mouth and into the esophagus and stomach. Endoscopy allows for battery removal and visual inspection of the esophagus for damage. If an endoscope is not available, removal by other means may be attempted. Transit time for disc batteries through the digestive tract ranges from 12 hours to 14 days. The majority of cells are passed in the stool within 72 hours. At home, strain stools for passage of the battery. Infrequent abdominal X-ray should be taken to confirm forward progression of the battery. If the battery contains mercury, has fragmented, that is viewed by an X-ray, blood and urine mercury levels will be ordered. Medication to lower mercury levels should be used only when the abnormal levels are found. What are complications and outcomes for battery ingestion? For the majority of cases, disc battery ingestion, conservative therapy is all that is needed. The battery will pass on its own. A disc battery lodged in the esophagus is rare. Only 2 cases of 2,382 studied had a major outcome. Both were young children with a large cell, 20 to 23 millimeters, lodged in the esophagus. When a battery narrows or blocks the esophagus, severe bleeding or abnormal passages from the esophagus to other organs may occur. All can be aided by surgery, but outcomes can be severe. Heavy metal poisoning, while theoretically possible, has not been clinically reported.